Hello, Kevin Wee here again. This is a video for my Cert 3 and 4 in fitness simulation assessment, and now we're talking about patients with lower back pain and how we modify exercises for them. So lower back pain can be caused by a variety of problems with any parts of the complex interconnected network of spinal muscles, nerves, bones, discs, tendons in the lumbar spine. So typical sources of lower back pain include large muscle nerve roots in the lower back. They go to the legs. Small nerves that supply the lower back may be irritated. Large paired lower back muscles, the erector spinae, may be strained. The bones, ligaments, or joints may be damaged. And a vertebral disc may be degenerating. So an irritation or problem with any of these structures can cause lower back pain or pain that radiates or is referred to other parts of the body. Many lower back problems also cause back muscle spasms, which don't sound like much, but can cause severe pain and disability. So certain causes of lower back pain have a tendency to occur more often in younger individuals versus adults. So in younger adults, 30 to 60-year-olds, are more likely to experience back pain from the disc space itself. For example, lumbar disc herniation or degenerative disc disease, or from a back muscle strain or other soft tissue strain. In older adults, so 60 plus, are more likely to suffer from pain-related joint degeneration, such as osteoarthritis or spinal stenosis, or from a compression fracture. So with this in mind, some of the contraindicated exercises and some safe, effective modifications where possible are recommended. So number one, look, the back extension with arms and feet off the floor, so like a Superman position. So on the floor, the tummy, you lift your feet, arms off the floor at the same time. This would be contraindicated because a lot of compression force you can feel on the lumbar vertebrae. So a modification would be with your forehead on the floor, arms reach forward and the legs straight. Lift the right arm and left leg at the same time, so opposite, then down, and then you switch limbs. So what this does is actually strengthens the lower back in a safer manner. One of the exercises that's contraindicated that can be modified is leg lifts. So when you're on the back with your legs straight and you lift both legs off the floor at the same time, I wouldn't recommend doing because there's a lot of compression force on the lumbar vertebrae. The modification, bend one knee and lift the other leg straight up to a 45-degree angle. And what this does is strengthen the front of the hip. Another contraindicated exercise would be the inverted neck stand. So when you're on your back, you push your body up in the air so your feet are pointing towards the ceiling and your body is off the floor, except the upper chest, neck, and head. So why it's contraindicated is because it increased intrathoracic, which is your chest, and cervical pressure. So the modification I've recommended for this is actually the glute bridge. So you keep your feet flat on the floor with your knees bent and you extend your hips up into the air. And this will strengthen your glutes and hamstrings, so areas around the lower back. And then lastly, contraindicated would be sit-ups if you've got lower back pain. I mean, this is pretty self-explanatory. So there's a lot of compression force on the lumbar vertebrae. So a modification was roll up just far enough to lift your head and upper back off the floor. And what this does is actually strengthen the front of your abdomen. So those are the 4 contraindicated exercises, but also 4 modifications that people can do with lower back pain.